Welcome to CIAP, the Clinical Information Access Portal. Here, you can access clinical information and resources that support evidence-based practice at the point of care. CIAP provides a collection of material, including medicines information, clinical decision support tools, citation databases, journals, and books. CIAP is available to all staff working in the New South Wales Public Health System. This guided tour will take you through the available resources by following the left-hand navigation menu on the CIAP homepage. The Quick Links panel contains links to the most popular and commonly accessed resources on CIAP. This is including the Australian Medicines Handbook, or commonly referred to as the AMH. The Australian Medicines Handbook provides comparative information and practical advice on Australian medicines. It is organised in chapters, then grouped according to properties, such as pharmacological class or therapeutic use. Micromedics is a comprehensive evidence-based US database, providing in-depth information on medicines. The homepage includes an intuitive search bar where you can search by drug, disease, patient education, and alternative medicine. Apart from the quick and in-depth answers, Micromedics includes drug interactions, Trissel's IV compatibility, drug identification, toxicology and drug product lookup, and drug comparison. Therapeutic Guidelines is commonly referred to as ETG. Therapeutic Guidelines provides Australian evidence and expert opinion-based guidelines and advice on drug use for specific indications. MIMS Online is the web version of MIMS pharmaceutical product information. MIMS contains both abbreviated and full product information, consumer medicines information, commonly referred to as CMI, and product images for pharmaceuticals available in Australia. It also contains information from the Society of Hospital Pharmacists of Australia, or SHPA's Don't Rush to Crush handbook. You can search by brand name, generic name, therapeutic class, or indication. Natural Medicines provides high-quality, evidence-based information about complementary and alternate therapies, diet, exercise, and nutrition. Natural Medicine approaches the subject of natural medicines from a completely objective and unbiased perspective. It seeks to answer questions about natural medicines by systematically identifying, evaluating, and applying scientific information so that the information provided can support your clinical decision-making process. The Australian Injectable Drugs Handbook is a comprehensive reference of over 450 injectable medicines. This 7th edition includes 23 new medicine monographs, 5 anti-venom monographs, and the addition of intravenous fluid monographs. Up to Date is an evidence-based, physician-authored clinical decision support tool. You can search by disease, symptom, lab result, procedure, or medication. Perhaps you would like to refine your search by adult or pediatric. Up to Date includes more than 1,500 corresponding patient information topics. Or perhaps you are just looking for graphics. This powerful feature allows you to search tens of thousands of pictures, charts, movies, illustrations, and more, all without ever leaving Up to Date. You can also quickly check for possible drug interactions with the Up to Date Drug Interactions program in partnership with Lexicomp. What's New provides clinicians with a summary of the most important new information added to the medical literature in the recent weeks. The Practice Changing Update section highlights specific recommendations and/or updates that may change clinical practice. BMJ Best Practice is a clinical decision support tool uniquely structured around the patient consultation with advice on symptom evaluation, test to order, and treatment approach. You can search thousands of clinical topics and over 6,000 clinical guidelines. Answers can easily be digested using the layout, as well as the top navigation menu that mirrors patient consultation. BMJ lets you download the monograph as a PDF, download, email, or print out patient leaflets for their information, utilize the references for future research, or watch procedural videos for training purposes. Pediatric Care Online is a pediatric decision support tool from the American Academy of Pediatrics. Pediatric Care Online was designed for healthcare professionals at the point of care. It provides access to evidence-based information, patient education, advice on red flag signs and symptoms, well-child resources, and over 100 key practice points. The Joanna Briggs Institute contains a unique suite of information, helping healthcare professionals with their evidence-based practice. It also provides 7 different publication types, including evidence summaries, evidence-based recommended practices, best practice information sheets, systematic reviews, consumer information sheets, systematic review protocols, and technical reports. The Cochrane Library is a collection of 6 databases. Cochrane contains different types of high-quality, independent evidence to inform healthcare decision-making. There is a 7th database that provides information about Cochrane groups. The Medications panel contains a range of specialty medication resources, including additional links to MIMS, Micromedics, the Australian Medicines Handbook, Therapeutic Guidelines, and Natural Medicines. The Australian Medicines Handbook Aged Care Companion provides medicines information to assist clinicians to ensure that older people gain the optimum benefit from their medicines and avoid inappropriate use. The Australian Medicines Handbook Children's Dosing Companion provides Australian medicines information for prescribing and administering medicines to children from birth to 18 years. The British National Formulary for Children is an authoritative UK reference for prescribing, dispensing, and administering medicines to children from neonates to 18 years old. The Children's Hospital at Westmead's Paediatric Injectable Medicines Handbook provides guidelines for preparing and administering injectable medicines. The Australian Immunisation Handbook opens a resource which provides clinical advice for Australian professionals on the safest and most effective use of vaccines in their practice. ToxNet is a group of databases covering chemicals and drugs, diseases and the environment, environmental health, poisoning, risk assessment and regulations, and toxicology. Within ToxNet, LactMed is a database that contains information on drugs and other chemicals to which breastfeeding mothers may be exposed. The Pharmaceutical Benefit Scheme includes details of the medicines subsidised by the Australian Government. The New South Wales Poisons Information Centre is a free information service providing advice on the management of poisoning and drug overdose. The Evidence-Based Practice Panel contains a range of evidence-based resources, including resources already listed on the Quick Links panel. Cochrane Clinical Answers provide readable, digestible, clinically focused entry point to rigorous research from Cochrane systematic reviews. They are designed to be actionable and to inform decision-making at the point of care. Each Cochrane clinical answer contains a clinical question, a short answer, and an opportunity to drill down to the evidence from relevant Cochrane reviews. There are also links to allied health databases, including PsychBite, SpeechBite, OT Seeker, and Pedro. The TRIP database is a clinical search engine designed to allow users to quickly and easily find and use high-quality research evidence to support their practice and/or care. As well as research evidence, TRIP also enables clinicians to search across other content types, including images, videos, patient information leaflets, educational courses, and news. The Guideline Panel contains links to reliable sources of statewide, nationwide, and international guidelines. The Diseases and Conditions Panel contains a range of resources, inclusive of ones already listed on the Quick Links panel, including BMJ Best Practice, Up to Date, Harrison's Principles of Internal Medicine, Paediatric Care Online, the Children's Hospital at Westmead Handbook, and Therapeutic Guidelines. In its 13th edition, Harrison's Principles of Internal Medicine is an American textbook. It covers many aspects of internal medicine, including basic science, pathophysiology, clinical science, diagnosis, and up-to-date treatment. The Emergency Care Panel contains links to a range of resources for emergency care staff. There are approximately 2,000 journals available on CIAP, with the most popular and commonly accessed journals found on the Journals panel. However, if you click on Full Journal List, journals may be searched in a few different ways. If you know the title, you can search by field or browse by letter. Perhaps you would like to browse by subject to see what journals are available for your specialty or area of interest. There are approximately 400 books and dictionaries available on CIAP. As with the journals, the most popular and commonly accessed resources can be found on the Books and Dictionaries panel. If you are looking to find a particular book that is not located here, you can click on the full book list. Just like the journals, you can browse by field or letter, or perhaps browse by subject. This will help you to find the books and dictionaries that are most relevant to your specialty or field of interest. The Databases panel contains a range of specialty citation databases for searching, including Medline, which is a citation database of life sciences, biology, and biomedical information. You can search for articles from academic journals, including nursing, dentistry, pharmacy, and healthcare. Embase is a citation database where you can search across topics, such as biomedical and pharmaceutical literature. It contains additional content such as European, nursing, and allied health titles. PsycInfo is a citation database where you can search psychological, social, behavioural, and health science journals. The database includes material of relevance to professionals in related fields. MCare is a premium nursing and allied health database, which is ideal for practice, research, or education. There are over 3,700 international journals indexed, access to over 1,800 journals, up to 250,000 record citations added each year, and nearly 5 million records dating back to 1995. The Tools panel contains a range of tools, inclusive of online calculators that are useful for clinical practice. The interactive ECG provides clinicians with support and training on the interpretation of ECGs. The interactive problems combine clinical history with an ECG and the interactive stepwise learning method. At the end of each case, there are questions for you to consider and links to the theory helping you learn ECGs in a clinical context. The Clinical Equipment User Manual Library is a tool assisting health staff to improve patient safety and reduce user-related errors. The library contains user manuals, directions for use, operating instructions, quick start lists, and troubleshooting guides for various pieces of clinical equipment. The Patient Education panel contains links to CIAP resources that provide a variety of patient information handouts that are able to be downloaded and printed. Clicking on the specialty guides will take you directly to a large range of specialties for you to choose from. As an example, clicking on the Emergency Care Specialty Guide will provide you with resources relevant to emergency care. Every specialty guide will have recommended resources. As you can see, CIAP provides a large range of clinical information to help support your evidence-based practice. This concludes this guided tour.